Okay, so picking up with part two, meningo encephalitis. Encephalitis is actually going to be inflammation in the brain. And this can actually be a result of um, many different things. But because of close association with the brain and spinal cord, infection of one structure will most likely lead to infection of the other structure. And amoebas can actually cause meningoencephalitis. Now, acute encephalitis is almost always caused by viral infections. Signs and symptoms will include behavior changes or confusion due to inflammation, decreased consciousness, and potentially even seizures, and a lot of very similar symptoms that we see with meningitis. Treatment is typically with a very common antiviral drug called acyclovir. This is an antiviral drug that's oftentimes used to treat herpes. Now, your arboviruses, these are called arboviruses because they're transmitted by arthropod vectors. You do have pretty worldwide distribution of these. They are clustered in tropics or subtropic regions. You oftentimes will see periodic epidemics, especially in temperate zones. And most vectors will feed on the blood of host. We do see millions of infections per year, mostly in developing countries or in those tropical areas. And we do see thousands of deaths each year. There is no satisfactory treatment for most arboviral treatment viruses. West Nile virus, this emerged in the United States in 1999. The CDC reported in 2008 that 1% of the U.S. population either had evidence of a past or present infection with West Nile. 70% of people who are infected with West Nile have no symptoms. Birds tend to be the amplifying host, and humans or other large mammals are dead-end host, meaning that it dies with the host. All encephalitis cases are treated with acyclovir, again, that antiviral drug. And in case that they are caused by this virus. Herpes simplex virus. Herpes simplex virus, types 1 and types 2. Type 1 is what we typically refer to as oral herpes, and type 2 is what we typically refer to as genital herpes. Both herpes simplex viruses, type 1 and type 2, can cause encephalitis in newborns of an HSV positive mother. So if the mother is HSV positive, it's especially with HSV2, it's very important that they know that and that they can address it with some preventative measures. The virus is disseminated and progress is oftentimes poor. Older children and young adults ages 5 to 30 and older adults also over the age of 50 are also susceptible. And it's caused most commonly by HSV1 in these populations. And it essentially represents a reactivation of a dormant HSV1 infection from the trigeminal ganglion, which is one of your cranial nerves, number 5. So looking at the acute causes of encephalitis disease, here's the summary table for those. Again, the arboviruses such as West Nile, and then herpes simplex viruses 1 and 2. Okay, so subacute encephalitis, the symptoms for this take longer to show up and they are less striking. And common causes for this are toxoplasma, persistent measles infections, and prions. So Toxoplasma gondii, this is pretty extensive worldwide as far as the distribution is concerned. It's estimated that a majority of the world's population is affected sometime over their lives. Infection in the fetus and immunodeficient is severe and often fatal. And people with a history of toxoplasma are more likely to display thrill-seeking behaviors. It is a flagellated parasite, and it can attack at least 2,000 species of birds and mammals. It has a primary reservoir is felines, both wild and domestic. Signs and symptoms, it's usually asymptomatic, comes across as a sore throat, lymph nodes enlargement, and low-grade fever. You can have chronic or subacute encephalitis in patients with immune suppression. Toxoplasma gondii infection during pregnancy. There's a 30% chance of the mother transmitting the infection to her fetus. You have congenital infection in the first or second trimester, and it's oftentimes associated with a stillbirth. Liver and spleen enlargement, liver failure, hydrocephalus, convulsions, damage to the retina, and blindness. And in this particular figure here, we can see Toxoplasma gondii infection during pregnancy and the cycle in cats and their prey. And this is why, a lot of times females that are pregnant, they should not be handling litter boxes from cats. Okay. Measles virus. Measles virus, we talked about this in chapter 18. Measles virus can cause subacute sclerosing panencephalitis. It's a very slow viral infection. Symptoms appear years after the initial measles episode, and it's caused by direct viral invasion of the neural tissue. It's unclear what factors can lead to the persistence of the virus in some people. Prions, we talked about these in the virus chapter. These stand for proteinaceous infectious particles. They contain no genetic material. They cause transmissible spongiform encephalopathies. And one of the most common types that we use the example of is Creutzfeldt-Jacobs disease. There's some more details on prions. Normal protein in the brain is transformed into a prion protein, and the altered protein spontaneously converts other normal proteins into the prion proteins, and the accumulation of the prion proteins causes plaques and spongiform damage or holes in the brain. This can cause disease when transferred to a new host, and this can be transmitted either by contaminated instruments or infected meat. And here you can see microscopic effects of spongiform encephalopathy. The top image there, this is a normal cerebral cortex section showing neurons and glial cells. And then the bottom section is a section cortex in a Creutzfeldt-Jacobs disease patient. And this shows numerous round holes producing spongy appearance that destroys the brain architecture and causes massive loss of neurons and glial cells within that structure. And here's a table that summarizes the subacute encephalitis diseases, Toxoplasma gondii, again, most concerning with pregnant females, and the trend, cleaning litter boxes. It can have very bad effects to the newborn. And then we have our prions. Okay. Zika virus. Zika is something that sort of popped up about a decade ago. And Zika is an RNA virus. It's transmitted by the bite of a mosquito via sexual intercourse and in utero. When adults are infected, they can experience a range of symptoms from none at all to skin rash, conjunctivitis, and muscle and joint pain. It also seems to trigger Guillain-Barré syndrome in some. Pregnant women are cautioned not to travel to Zika endemic areas, as there have been some issues of it causing congenital Zika virus syndrome with microencephaly. Additional symptoms of the syndrome include vision problems, involuntary movement, seizures, and irritability. There's a table on Zika. Rabies. Rabies is a slow progressive zoonotic disease characterized by a fatal encephalitis. Zoonotic is, what that means is that the infection can be transferred from one animal species to another animal species. This is somewhat an oddball man out here, because typically what will make you sick will not make your dog sick, and vice versa. But obviously rabies is one of those diseases that can actually make multiple animal species sick, including humans and dogs. There's two stages. You have furious rabies. This is where you have agitation, disorientation, seizures, twitching, hydrophobia. And dumb rabies, where the patient is paralyzed, disoriented, and stuporous. Both forms progress to a coma phase, and death results from cardiac or respiratory arrest. Here's the structure of rabies. In the first figure here on the left, you can see a color-enhanced virion, which shows internal serrations, which represent tightly coiled nucleoplasmin. And in the cartoon version over here, this is a schematic model of the virus showing its major features. Here you can see the glycoprotein spikes, the matrix protein, and the nucleocapsid. Rabies transmission. Wild mammals such as canines, skunks, raccoons, badgers, cats, bats. A lot of our domesticated animals, though, are vaccinated, so we don't really see that as a huge source. Spread to domestic animals and humans through bites, scratches, and inhalation of droplets. It's estimated that there are 35 to 50,000 human cases worldwide. In the United States, that accounts for about 6,000 to 7,000 animal cases per year. In 2004, the transmission of rabies through donated organs and tissues was first identified, meaning that you had a individual who was infected with rabies. And I believe I used to have this article up on the PowerPoint. If I remember correctly, he was a hunter, most likely came in contact with a rabid animal, ended up dying in a car accident, and was an organ donor, and his organs were harvested and then transplanted into other patients. And unfortunately, they actually also developed rabies as a result. Transmission can also occur through cornea implants. Prevention and treatment. It is imperative that treatment begins after the exposure, but before symptoms develop. You have both passive and active post-exposure immunizations. It's a series of immunizations that are administered. It's not a fun series to have to be able to get. Vaccination of domestic animals, veterinarians and animal handlers, laboratory personnel, and travelers. It's recommended for all these individuals to be vaccinated. Vaccine is incorporated into the bait to treat wild animals. And here's the table on rabies. Polio. Poliomyelitis is an acute enteroviral infection of the spinal cord. It can cause neuromuscular paralysis. Signs and symptoms include fever, headache, nausea, sore throat, malaise. Neurotropic. It infiltrates the motor neurons of the anterior horn of the spinal cord, and it can also attack the spinal ganglia, cranial nerves, and motor nuclei. It can cause paralytic disease. You have various degrees of flaccid paralysis of the muscles of the legs, abdomen, back, intercostals, diaphragm, pectoral girdle, and the bladder. Bulbar poliomyelitis. This can affect the brainstem, the medulla, and the cranial nerves. And then post-polio syndrome. This is progressive muscle deterioration in 25 to 50% of patients decades after the initial infection. Humans are the unknown reservoir for polio. Vaccination is very early in life with 4 doses starting at 2 months of age. Like I said, due to the vaccination, we have seen significant decreases in polio in the United States and even worldwide. Here you can look at a map looking at 1988 versus 2018. And you can see that polio has been pretty much eradicated worldwide, except for 2 countries. Here's the disease, or the review table for polio. Tetanus. Tetanus is caused by Clostridium tetani. It's a common and resident of the soil and GI tract of animals. It is a gram-positive endospore-forming bacteria. It can be found on inanimate objects because it's a spore-forming bacteria. That's why if you are cut with a deep, sharp object that maybe was exposed to the element, they will ask, when was your last tetanus shot? Because these spores could have been, allowed to enter into the deep tissue. Endospores are only produced under anaerobic conditions. And in this photo here, you can see the typical tennis racket morphology of Clostridium tetani, which is created by the terminal endospores that swell the end of the cell. Neonatal tetanus kills approximately 35,000 newborns each year. Majority of infections are a direct result of unhygienic practices during childbirth in developing countries. It's not really something we see here in the United States. And here you can see a baby with neonatal tetanus showing spastic paralysis of the paravertebral muscles, which locks the back into a rigid arch position. And this also shows abnormal flexion of the arms and the legs. The neurotoxin will end up producing tetanospasmin. Is the neurotoxin that's produced by Clostridium tetani. And it binds the target sites on the peripheral motor neurons on the spinal cord, brain, and sympathetic nervous system. And as this toxin binds to those target sites, it blocks the inhibition of the muscles contraction, causing muscles to contract uncontrollably, resulting in spastic paralysis. And eventually, if this is left untreated, death will result as the respiratory muscles and the respiratory muscles sort of go into a paralytic state and leads to respiratory arrest. So here in the figure, we have in figure A, after traumatic injury, bacteria infecting local tissues secrete tetanospasmin, the toxin, which is absorbed by the peripheral axons and is carried to the target of the neurons in the spinal column. In B, in the spinal cord, the toxin attaches to the junctions of the regulatory neurons that inhibit the inappropriate contractions. It's released from inhibition. The muscles, even opposing members of a muscle group, receive constant stimuli and they will contract uncontrollably. And in figure C here, you can see muscles contract spastically without regard to regulatory mechanisms or conscious control. This photo shows a clenched jaw, which is typical in the early stages of tetanus. And if you have what we refer to as lockjaw, you definitely want to get treated as soon as possible. Now, tetanus is one of the world's most preventable diseases. Vaccination with tetanus toxoid, usually in combination with diphtheria and pertussis, and it's referred to as the DPT vaccine, Vaccinations are given to children under 7 years, and then you have a tetanus booster, which should be given every 10 years thereafter. The toxoid should also be given to injured persons who have never been immunized or have not completed the series or who have had a booster that's older than 10 years. Some places will even go older than 7 years. And the vaccine can also be given with passive antibody treatment. And here is the table for tetanus. Okay. Botulin toxin. Botulin toxin travels from the bloodstream to the neuromuscular junction of skeletal muscles, prevents the release of acetylcholine, resulting in flaccid paralysis, and it's utilized by doctors to treat uncontrolled muscle spasms, migraine headaches, or other conditions. Botulin toxin is also used cosmetically as Botox. And botulin toxin is secreted by another spore-forming bacteria called Clostridium botulinum. In the first figure here, you see the relationship between the motor neuron and the muscle at the neuromuscular junction. You may have learned about that in anatomy. In figure B, in the normal state, acetylcholine is released at the synapse. It crosses to the muscle, and it creates an impulse that will stimulate the muscle contraction. In a botulin one, the toxin enters into the motor and end plates and attaches to the presynaptic membranes, where it blocks release of the chemical. This prevents impulse transmission and keeps the muscle from contracting, and this will end up causing flaccid paralysis. Botulin intoxication. This is caused by the exotoxin. This is often associated with eating poorly preserved foods, and there are three major forms: foodborne botulism, infant botulism, and wound botulisms. And again, the causative agent, I think I missed a slide. I'm missing a slide. But anyway, the causative agent is by Clostridium botulinum. It's another it's another spore-forming bacteria. And like I said, it is something that's used for medicinal purposes, especially for migraine headaches or muscle spasms. But it is also used cosmetically as Botox. Okay, African sleeping sickness. This is caused by T. brucei and trypanosomiasis. Affects millions of individuals in 36 countries in Africa. And it's transmitted by the TT fly. And what happens is it affects the brain. What the symptoms of African sleeping sickness are: you'll have intermittent fever, enlarged spleen, swollen lymph nodes, joint pain. You can have personality and behavior changes, extreme fatigue and sleep disturbances, uncontrolled sleepiness during the day, sleeplessness at night, muscle tremors, shuffling gait, slurred speech, seizures, local paralysis, and oftentimes death will result from a coma, secondary infections, and heart damage. And here is the table for African sleeping sickness. And then finally, this is just the table that sort of summarizes. We saw this at the end of chapter 18, and you'll see it at the end of every chapter. Essentially, the taxonomic organization of microorganisms causing disease in the nervous system. So you have your gram-positive endospore-forming bacteria, gram-positive bacteria, gram-negative bacteria, DNA and RNA viruses, your fungal prions, and protozoa. And then this sort of takes all those different organisms and kind of shows you where within the nervous system here, illustrated where they can be of an issue. Okay. And that is the end of this chapter and this recording.